Welcome to our online virtual program, the COVID-19 vaccine, discussing some of the truths and some of the nonfictions about it. Our speakers today are Julianne Burns, who is a pediatrician who specializes in pediatric infectious diseases. She completed her fellowship at the Children's Hospital of Philadelphia, where she also received training in clinical epidemiology. She is currently a medical specialist in immunizations under the Division of Disease Control at the Philadelphia Department of Public Health. Our other speaker this evening is Nicole Spector. Nicole is an adult gerontology primary care nurse practitioner. She completed her training at Northeastern University in Boston, Massachusetts. She specializes in public health nursing, working primarily in infectious disease prevention, healthcare for people experiencing homelessness, and substance abuse treatment. She is presently working in the immunizations program of the Philadelphia Department of Public Health, Division of Disease Control. And my name is Alex Bender. I am a library coordinator with the Division of Enrichment and Civic Engagement at Parkway Central Library. And without any further hesitation, I am now turning the program over to Nicole and Julianne.
Thank you, Alex, and thank you everyone to the Free Library of Philadelphia for having us both. We're very happy to be here. And we're looking forward to your questions. So I'm going to start the presentation off. And Julianne's going to control my slides. Thank you. So just briefly, this is what we're going to cover in the presentation today. We'll go over some information about the COVID-19 vaccines, vaccine distribution, who can get the vaccine in Philadelphia and how. And then Julianne will talk briefly, or I think actually I'm going to talk briefly about achieving racial equity in vaccine distribution, and then we'll go to your questions. So just a little bit about the COVID-19 pandemic. I know we're mostly here to talk about vaccine, but just to kind of bring it back a little bit and remind us why we're here in the first place and everything that has gone on in this past year. So as you know, COVID-19 is an illness that's caused by a respiratory virus. It spreads very quickly from person to person, and it can be deadly, as we see with over 500,000 deaths in the United States in the past year. The virus that causes COVID-19 most commonly spreads from respiratory droplets during close physical contact that happens when you're sneezing, talking, or coughing within 6 feet of another person. So the virus can sometimes spread from person to person by small droplets or virus particles that linger in the air for minutes to hours. And this happens most commonly in an enclosed space inside a building with limited ventilation. In general, being outdoors and being in spaces with better ventilation will reduce your risk of exposure. Anyone can have mild to severe symptoms of COVID-19. And older adults and people who have severe underlying medical conditions such as heart, lung disease, or diabetes seem to be at a higher risk for developing more serious complications from COVID-19 illness or death. And just as a brief review, the symptoms of COVID-19 disease can include cough, usually a dry cough, shortness of breath or difficulty breathing, fever or chills, muscle or body aches, vomiting or diarrhea, or new loss of taste or smell. And these usually occur 2 to 14 days after exposure to the virus that causes COVID-19. And on the right, we just have a couple of emergency warning signs of COVID-19, which a person experiencing these should seek medical care immediately. Trouble breathing, chest pain, new confusion, difficulty staying awake, or any signs that you're not getting enough oxygen, such as pale gray or blue colored skin. And here's just a quick graphic that shows how the United States is doing with its COVID-19 vaccination efforts. Overall, it's going slowly but surely. In the United States, they have administered over 93 million vaccines. If you see at least 60% of individuals over age 65 have received at least one dose, and 30% of those individuals are fully vaccinated, which is great. So now I'll go into the vaccines in a little bit of more detail. How do we know that these vaccines are safe and effective? So the COVID-19 vaccines are being held to the same safety standards as all other vaccines, which in general are very strict, more strict than other types of medications. All of the vaccines that we have available today were tested in large clinical trials, which included diverse populations, older individuals, and people with multiple underlying medical conditions. The FDA's Emergency Use Authorization, or EUA, is a process that helps facilitate the use of medicines and vaccines during public health emergencies, such as our current pandemic that we're in. So some of the criteria that they had to meet to pass these, or to allow these vaccines to be used under the EUA, were that they had to be at least 50% effective at a minimum. All are well above that. The trials needed to last 2 months so we could get safety and efficacy data after they completed dose number 2. And all the data submissions were reviewed by an independent committee, the Vaccines and Related Biologics Vaccine Advisory Committee, which was done. And compared to an approval through the FDA, which can take many, many years, the EUA is an expedited process. And so all of the vaccine companies have to continue to report the data to the FDA on how effective it is, as long as it's used under this EUA. Fast tracking COVID vaccines. So how did we get these vaccines so quickly after they were developed? So researchers used existing networks to conduct the trials for the COVID-19 vaccines. They also began manufacturing them while clinical trials were still underway, which normally doesn't happen until they complete the trials after many years of testing. The technology for these vaccines had been previously developed, and they were able to apply that technology to these new vaccines. And due to the nature of this public health emergency, the FDA and CDC prioritized the review and authorization of these COVID-19 vaccines to prevent further loss of life. And so just a little bit about the 3 vaccines that are available today. Just go over this quickly. The Pfizer vaccine and the Moderna vaccine are both mRNA vaccines, which I'll go into a little bit on the next slide. But they are both 2-dose vaccines. The Pfizer vaccine is given 2 doses 21 days apart, and it is approved for individuals ages 16 and up. And this is the one that is stored in a very, very cold freezer. The Moderna vaccine is 2 doses as well, but 28 days apart, and it is approved for individuals ages 18 and up. The Janssen or Johnson & Johnson vaccine that was just approved under the EUA, it's a different type of vaccine called a viral vector vaccine. It is 1 dose, and it's approved for individuals age 18 and up. So none of these vaccines contain the COVID-19 virus, and none of them can give you COVID-19. None of the COVID-19 vaccines can change our DNA in any way, and they will not cause you to test positive on a COVID-19 viral test. You don't need to quarantine after getting these vaccines. Again, you cannot spread COVID-19 from being vaccinated. And so what is an mRNA vaccine? And as a reminder, that's the Pfizer and Moderna products. So these currently approved vaccines use a small strip of genetic code called mRNA. So this code teaches your body how to make the spike protein that's found on the COVID-19 virus. It doesn't contain it, but it's a code that teaches your body how to actually create antibodies or proteins that fight infections. So once your immune system recognizes that spike protein, they'll create the defense, and they'll stay in your body and are able to fight off COVID-19 if you're exposed in the future. And what is a viral vector vaccine? So that's referring to the Johnson & Johnson vaccine. So viral vector vaccines use a modified or weakened cold virus This cold virus cannot cause an infection, meaning it can't copy itself and make lots of copies in your body. But it is able to deliver important instructions in the form of a gene to our cells. That gene teaches the body how to make the spike protein again found on the COVID-19 virus. It does not change the core DNA in our cells. Once your immune system recognizes that spike protein, again, it will create the antibodies. And those are the proteins that will fight the infections off, and they'll stay in your body and can fight off COVID-19 if you are ever exposed. And just some data about COVID-19 vaccine safety and efficacy. In the clinical trials, all 3 of these COVID-19 vaccines were found to be very effective against symptomatic COVID-19, ranging in efficacy from 72 to 95%, which is all very high efficacy rate. All COVID-19 vaccines were highly effective, over 89%, against severe COVID-19 that is serious enough to require someone to go to the hospital. In the vaccine trials, no participant who received any COVID-19 vaccine died from COVID-19. And what should you expect after you receive your COVID-19 vaccine? So both the mRNA, the Pfizer and Moderna, and viral vector, Johnson & Johnson vaccines are expected to produce symptoms after you get your vaccine. Some of these symptoms might include a fever, a sore arm where you got the shot, a headache, muscle aches and pains, tiredness. These are signs that your body is building up protection against COVID-19. They usually last for a day or 2, and they could come on about 1 or 2 days after you receive your vaccine. And it takes 2 weeks after completing your vaccination series, so either if you get the 1-dose vaccine or if you get the 2-dose vaccine, 2 weeks after your last dose, for your body to be fully protected. And also, if you do get symptoms from the vaccine, you're able to take an over-the-counter pain reliever such as Tylenol or Advil to relieve any symptoms. And I will turn over the rest of the vaccine portion to Julianne.
Hi, everyone. Thank you, Nicole. So I'm going to review some eligibility for COVID vaccination. First, who should receive the COVID vaccine? Anyone who is eligible, especially people who work or live in high-risk settings or who have a high-risk medical condition. People who have had COVID can also receive the COVID vaccination. And we actually do recommend it because we don't know how long natural protection from a past COVID infection will last. So we think that the vaccine will give you the best chance of protection if you're exposed to COVID in the future. You should talk to your healthcare provider if you're pregnant or you have concerns about your individual health condition, or if you have allergies to medications received by injection. So your doctor can discuss those specific concerns with you and decide on the best place for you to be vaccinated. Who should not receive the COVID vaccine? So there's just a few listed here. Anyone with a previous severe or immediate allergic reaction, so one that causes anaphylaxis, which is a severe allergic reaction or requires medical intervention to a COVID vaccine or a vaccine component. This is pretty rare, so you should, most people can receive the vaccine even if they have a history of allergies to medicines by injection or oral medications, or of course, if they have any environmental or food allergies. So just discuss with your doctor if you have any questions about that. Those younger than 16 years of age at this time cannot receive the vaccine, but we hope they will be able to do so in the near future after more studies are done in children. People currently isolating or experiencing symptoms of COVID-19, these people can get vaccinated once they are finished isolation and their primary symptoms have resolved. We just don't want to expose any of the staff at the vaccination center to the COVID virus. So that's the reason that we would recommend that you wait until you're done with isolation or quarantine. And then people who have received another vaccination within the last 2 weeks, these people should just wait for 2 weeks, and then they can get the COVID vaccine. We just need to learn more about any possible interaction between getting 2 vaccines at once. So we just ask that you wait for 2 weeks after you've received a vaccine before getting the COVID vaccine. So I'll discuss a little bit more about safety and efficacy, which in some of the common questions that, that people have. So we don't know how long protection from vaccines will last because they have been in use for less than a year. There is a lot of ongoing research to determine this. People who initially got the vaccine in the clinical trials are still being studied. So we hope that with time we'll have more information about this. And we'll know if any booster shots are needed in the future to boost protection against COVID. We of course hope that the COVID vaccine will last a long time and give us protection for a long time. The CDC is continuously collecting data about side effects using what's called the VSafe program and other monitoring systems. So this is actually something that you can enroll in after you receive the COVID vaccine. Every vaccination site should have flyers, and you you input your information into the program, and then they will text you every day after you've received the COVID vaccine, and you'll check in and tell them what symptoms you're experiencing. It does decrease after some time, so I think after the first week or two it goes to weekly, and then it will check in with you for 6 weeks after the second vaccine. So there's this, and there's other mechanisms as well, such as reporting systems that different clinical providers use if they are concerned about any possible adverse vaccine events. So they can report these things, and there's other surveillance techniques that the CDC and other entities use to just make sure that they're detecting even rare side effects. The good thing is that no other adverse events have been detected, and the vaccines have been still determined to be safe and effective, even with all this monitoring. The CDC is continuing to provide us with updated information and analysis of all their data sources. Furthermore, we did have an update this week from the CDC, specifically about pregnancy and infant outcomes. And the good thing is that no unexpected pregnancy or infant outcomes have been detected related to COVID vaccination during pregnancy. So in the United States, pregnant women can receive the vaccine, and they're recommended to discuss with their doctor to make the best choice for them, because the vaccine there's limited information available about the vaccine in pregnant women in the trials. So the CDC continued to monitor people who got the vaccine through all of these mechanisms who were pregnant, and then they were able to report that there wasn't any unexpected events of concern. And then furthermore, there are no expected events on no expected effects on fertility or breastfeeding. So getting the COVID vaccine should not affect these things in any way. And then again, the COVID vaccines do not interact with any medications. So you can always talk to your doctor about specific concerns. But in general, you shouldn't be worried about any medication side effects, any medication interactions with the vaccine. So which vaccine is best for me? This is a question that we get now that we have 3 vaccines available. So the best vaccine is the first one that is available to you. There's no preference for any of the 3 vaccines from the CDC or other bodies that recommend vaccine use in the United States. And it's hard to compare these vaccines directly. First of all, these vaccines were not compared directly head-to-head in clinical trials. They were done, separate trials were done for each one. And these trials were done at different times in different countries and with different rates of COVID infections in the population, and even with different COVID variants around. And so this was especially true for the Johnson & Johnson trial. So as more variants came to light around the world, as time passed by, the Johnson & Johnson vaccine was tested against some of those, but the other vaccines, Pfizer and Moderna, that were approved first were not. A question that does come up along this vein is that, will I be protected from COVID variants? So we do think that the current vaccines, even the Pfizer and Moderna vaccine, will give some protection. The J&J vaccine was specifically tested against the South African and Brazil variants, but research is ongoing into this aspect. Overall, the best way to combat variants from forming in our communities is to vaccinate our community and continue all the measures like masking, social distancing measures until we have herd immunity in our community. Here are a few facts about the COVID vaccine. There's no charge for the COVID vaccine. It was purchased by the federal government, and so there's no charge or copay for anyone receiving the vaccine. You do not have to have insurance, and there should be no proof of insurance required to receive the vaccine. Also, proof of citizenship is not required to be vaccinated, and no one should ask you for proof of citizenship. The only thing they might ask you is something to prove that you live in a certain county, just so, because each county gets their own vaccine allocation from the federal government. And so of course, each county wants to vaccinate their own population. So it's only for the purpose, if it comes up, of saying where you live, but there's no proof of citizenship. You don't have to have an official government ID or anything like that. So no one, you shouldn't have to show any proof of that. And it's not mandatory to be vaccinated. And the city has no plans at this time to make vaccination mandatory. In general, vaccines that are under an EUA are in general, employers and governments should not make those vaccines mandatory. So we, of course, encourage you to make the best choice, individual choice for you, but it should not be mandatory. Do I still need to use precautions after vaccination? This is a very common question, and I'll just talk about this on these two slides. So first, right now, it is critical to continue to wear a mask, wash your hands frequently, and social distance even after vaccination, for now at least. COVID is still circulating in our communities. Unfortunately, a lot of people are still getting sick and dying from COVID, and so we need to protect the people around us. Vaccination is just one layer of protection against COVID-19. It does take time for the vaccine to be fully effective. So again, as Nicole mentioned, it takes about 2 weeks after completing the vaccine series. So after the second dose for the Pfizer and Moderna vaccines, and after the 1 dose for the Johnson & Johnson vaccine. So you don't have full protection until that time. So while everyone is getting vaccinated, they are not yet necessarily fully protected. And then if people are exposed to COVID after being vaccinated, we don't yet know if they can still spread COVID without developing symptoms. So even if they don't get sick themselves, we don't know if they could spread the COVID virus to others. Research is still ongoing to determine this and to what extent people can still pass the virus to others. And overall, the research is leaning on saying that the risk of spreading COVID-19 is much less if you are vaccinated. So you are protecting the people around you if you're vaccinated, but we still need to study more about this. There is good news. So just recently, the CDC gave some updates on what fully vaccinated people can do. So there are some benefits of vaccination. Fully vaccinated people can visit with other fully vaccinated people indoors without wearing masks or physical distancing, assuming that they're all protected from severe COVID disease. They can visit with unvaccinated people from a single household if all the people in that household are low risk for severe COVID disease, even indoors without wearing masks or physical distancing. So this would be an example if fully vaccinated grandparents went to visit a young family with children. In general, of course, younger people are at less risk of getting severe COVID disease if they get ill, and children as well. So this is, of course, there is some risk, but it probably is a pretty low risk that vaccinated grandparents who have a low risk of passing COVID to these people, and then the people themselves have a less risk of getting sick. So it is probably a low risk situation. And fully vaccinated people can also refrain from quarantine and testing if they are exposed to someone with COVID, if they remain asymptomatic. So they don't have to quarantine for the 14 days, as long as they just, watch themselves and make sure they don't develop any symptoms, because it's very low risk. However, otherwise, you just like I had mentioned on the previous slide, you should continue to take the same precautions in public and when visiting other people who don't fit into these categories. Or if they're people who are, even if there's some people in the household who have been vaccinated, if there's other people who, for example, have not been vaccinated and are at high risk of COVID, you still should follow precautions. They also recommend that everyone continue to avoid medium and large size in-person gatherings. So making the decision to get the vaccine. We just wanted to leave you with some closing thoughts on this portion before we go a little bit more into vaccine distribution. So the risk of getting severe illness and dying from COVID-19, from the virus, far outweighs any benefits of natural immunity. We would recommend that you talk to your healthcare provider, think about your own exposure to COVID-19 where you work and live, and consider your own medical history. We encourage you to inform yourselves and make the best decision for yourself and the people around you in terms of getting the COVID vaccine. So Nicole is going to talk I'm going to talk about a little bit about vaccine rollout. Sorry, forgot. So questions that come up are who can get the vaccine in Philadelphia and how? So we'll give a brief overview of this. And then again, we're happy to answer specific questions at the end. So to start with, in terms of COVID vaccines, as you well know, there was only a limited supply of COVID vaccines after they were approved. So of course, the manufacturers were continuing to make COVID vaccine while it was being studied in the hope that it would be shown to be safe and effective. And once it was, there was some vaccine that was available, but there is more and more vaccine with each week. But because of the limited doses available, we had to use a phased approach to COVID vaccination. So that's why there are different, that our country and states and our city has different categories to prioritize those at high risk for COVID, severe disease and death from COVID, and at high risk for occupations in terms of getting exposed and passing COVID to others. So you can imagine the circle here represents phase 1A, phase 1B, and phase 1C, kind of going up. And then phase 2 is when there's a large number of doses available and the general public can get the vaccine. And then phase 3 is a continued vaccination and kind of a shift to routine strategy where the vaccine is widely available at doctors' offices and you can get the vaccine when you need it. So Philadelphia is currently vaccinating individuals in phases 1A and 1B. We have administered a lot of doses. There has been almost 300,000 first doses administered in Philadelphia and almost 125,000 second doses administered. This information is freely available to anyone on the vaccination dashboard on our health department website, and it's updated regularly. So, and you can see different things like the breakdown of age and gender, race and gender, and by zip code. And we are tracking this very closely in the health department, and especially things about inequities by geography or by race, and trying to close this gap between and make it more reflective of our population as a whole. So these inequities is something that we absolutely are trying to rectify in every way possible. So who is in group 1A? These are people, again, at high risk for exposure and transmission to vulnerable populations, such as patient-facing healthcare workers. So the list is here. And then simultaneously, those at high risk of morbidity and mortality, which include long-term care facility residents. So a lot of this population has already been vaccinated. There still might be some people in these categories who haven't, and we encourage people who are in these categories and haven't to register for vaccination. Some of the ways that we'll describe at the end of this presentation, or if they've made the decision now to get the vaccine, even if they perhaps they wanted some time to think about it and did make the decision right away, but now want to get the vaccine, they still definitely can. So we haven't, we're still vaccinating people in this category. We haven't passed it over. So you can still get the vaccine if you're in this category. But we have moved to 1B, and in each category, we're going down the list in terms of priority. So we are simultaneously vaccinating both categories, those at high risk for exposure and who perform essential duties, and also those at high risk of morbidity and mortality. So as you can see, there's people like in the first column, things like first responders, service providers working with high risk populations, public transit, food distribution, childcare and education providers is, as you've heard probably in the news, is really a current push. And then some other volume of essential retail and manufacturing critical goods. These are some of the populations towards the bottom here that we're currently strategizing, working towards getting them vaccinated. But simultaneously, people at high risk of morbidity and mortality includes those in congregate residential settings. We have a lot of different strategies and small teams that go out to some of these facilities to reach these people. Persons age 65, that was actually a change this week. So it used to just be persons 75 plus. But we did make that change given the greater availability of vaccine every week, and to make our guidance more in line with the state, because the state of Pennsylvania did have the criteria of age 65 plus. And we are simultaneously vaccinating those with high risk medical conditions, regardless of age. To find out more about what these conditions would be, we do encourage you to go to the health department website or talk with your physician. There's a specific list that's targeted based on the evidence that we have so far. But I also encourage you to check back on the site for updates, because we do get more evidence, continuously available. And then we have a committee made of community members and community leaders, which helps decide these categories in general and any new additions to these categories along with the health department. And then phase 1C, we hope to get to, I think by May is the latest I've heard, although that's just an approximation. And these are other essential workers who have a lower risk of exposure, but still important risk of exposure. And then the high risk of morbidity and mortality, that used to be 65 plus, but they have now been moved to the category of phase 1B. So different vaccination strategies. We'd be happy to talk more if any questions come up, but there's a variety of different strategies that the health department is using in conjunction with other partners. So these could include agency hosted vaccination clinics. So for a specific occupation or group operated by the health department or another partner, retail pharmacies. There's a specific partnership federally with different pharmacies, and then we also give vaccine to independent pharmacies. There are also federally qualified health centers and outpatient clinics which receive vaccine. Right now, actually, for many weeks, there have been Philadelphia Department of Public Health mass vaccination clinics, and we are expanding these currently in many communities. And then we also have the FEMA site at the convention center. So that has been operating for almost, let's say, I think between a week and a half and 2 weeks now. And we'll give first doses for another week, and actually might be operating for a few more weeks. We're still kind of determining the final schedule. But so a lot of opportunities to get vaccines through these mechanisms if you're in one of the phase 1A or phase 1B groups. A lot of hospitals and larger organizations are also holding mass vaccination clinics. There's other groups like the Black Doctors COVID Consortium, which are holding these mass vaccination events. So again, a lot of opportunities. And then like by our community funder partners and et cetera, which are listed here. And then this is a map which is freely available on the website that you can check weekly for updates. So it includes things like on this website, we don't have it displayed here, but like the doses that the city has received. Again, if I didn't mention earlier, the city does receive its own vaccines that are separate from the state. So we are our own public health jurisdiction. So we receive our own vaccine supply. So the vaccines that the city did receive, the number of doses is listed here. Any updates on ongoing vaccination efforts, where the mass vaccination clinics are, et cetera, different partnerships are listed there, along with different vaccination opportunities and the doses administered. And then there is a map that represents all the approved sites that can distribute vaccine in the city as well, and kind of by category. So how do you register for getting a COVID vaccine through a city site? So again, there's different channels to get vaccine, and you can talk to your doctor about opportunities that are available through your clinic or health system, or through other partners. But if you'd like to get a vaccine at a city clinic, then we would recommend that you register on this interest form. And there's a couple different ways to do this. You can, one way is to just call 311. So 311 is actually now set up to help with registration. So if you don't have access to the internet or just would prefer to do it this way, then you just call 311 and they can help you through the form. And then the second way is to go on the Philadelphia Department of Public Health website. You'll see a big red banner at the top that will say, sign up for a vaccine today, and with an easy link to click on, and then you can fill out the form. And it'll ask you questions just to see if we can, so it can better screen for what group you qualify in. So even if you don't think that you are in the group 1A or 1B right now, we still recommend you fill out the form as accurately as possible. And then you will be in our database to be notified about future vaccination opportunities. So it's not too late. And even if you're not in the group right now to be vaccinated, we definitely recommend that you fill out the form. So I signed up, now what? So wait for the health department to contact you. Sometimes you might not hear right away from the health department, especially if it's not, we're not currently vaccinating the group that you fall into. But when you are eligible and there's vaccine for you, you will be contacted by phone or email. If you don't have an email address, that's fine. We will reach out to you by phone. Then you can set up your appointment and then you can get vaccinated. So Nicole is going to talk about achieving racial equity in vaccine distribution, which is the last part of the presentation.
Thank you. Okay. Do you mind going to the next slide? Thank you. So we're going to approach this in a couple different ways. To achieve equity, we're working on improving access to vaccine. So a couple of things that we're doing to improve access are positioning vaccines in federally qualified health centers and retail pharmacy chains that are located in low-income neighborhoods and are staffed and utilized by persons of color. We've partnered with the Black Doctors COVID Consortium, which are doing amazing work with their clinics. We're prioritizing vaccine access in geographic areas that are highly vulnerable per the CDC Social Vulnerability Index and have low vaccination rates. We've also issued a request for proposals for community-based vaccine partners. We're also working to publish data that's broken down by race, ethnicity, gender, age, and then eventually zip code of residence. And we're requiring sites to report race and ethnicity data so we can understand who we're vaccinating and who we're not reaching. We're also working on our outreach strategies and engagement of communities. So we've been doing this by hosting virtual town halls with community leaders and residents to listen to their concerns and answer questions about the vaccines and our rollout. We're creating plain language materials that are diverse, culturally competent, and translated into many languages. And we're working with community partners to disseminate these materials to reach many audiences. We're training our call center staff to answer vaccine-related questions and also to register callers for the vaccine interest form and schedule for our mass clinics and the FEMA site at the convention center. And we're going to be partnering with Philly Counts to train trusted messengers on vaccine messaging to get the word out in the communities. We're also working to protect essential workers. So we're planning to vaccinate first responders, food service workers, teachers, childcare workers, and Spector workers. Actually, all of these people have been receiving vaccine already. We've been hosting listening sessions for effective engagement with essential worker groups, and we're prioritizing essential workers from affected and highly vulnerable zip codes. We're also working with unions and community-based groups. And here are just some resources about the different fact sheets from the 3 vaccine products. And if you want to check up on any of the information that we've presented today, you can go to www.phila.gov/COVID under the vaccine tab. You can kind of find a lot of this information and just check on our newsletter, check on the dashboard to see how many people have been vaccinated, how the city is doing. If you have any questions, you can email covidvax@phila.gov. And we recommend referencing the CDC or clinician outreach and communication activities just for more detailed information about the vaccines. And thank you for your attention, and we'll answer any of your questions now.
And it does look like we have a couple of questions. The first, what other ingredients are in the vaccine, and it has to be more than the mRNA is the follow-up to that question.
Great question. Julianne, however you want to do this.
Sure, either way. You can answer and then I'll add if.
Okay, great. So the main component of the vaccine, the 2 mRNA vaccines at least, is mRNA, which is a protein. So they're able to put the mRNA in basically a fat, which is called a lipid. And that helps to protect the mRNA because it's very fragile. And it provides kind of like an exterior around it that helps it to get into the cells. The vaccine also has salts in it that help to balance the acidity when it's in your body. And then it also has some sugars, and that helps to kind of maintain the molecule shape when they're at cold temperatures. So it's just to stabilize it. As I said, the mRNA is very fragile. Did I miss anything, Julianne? I mean, it's like long names of these different ingredients, but they're basically broken down into a fat, acids, and sugars. Or salts, excuse me. Oh, maybe Julianne's not here anymore. Not sure if that answered your questions. I can like put the full list of ingredients, but there are no preservatives. There's no pork or animal products. There is no latex, nothing like that in any of the vaccines.
Okay, and it does look like we may have lost Julianne. Okay, moving on to the next question. Why should a healthy person take this vaccine if this virus is just the common flu?
Yeah, so over the past year, the flu is a pretty serious illness in and of itself. Both the flu and the virus that causes COVID-19, which is a new coronavirus called SARS-CoV-2, both of them can actually be pretty deadly and they can affect people in the long term. But over the past year, we've been able, and scientists have been able to find out that COVID-19 spreads much more easily than influenza, and it causes serious illnesses in some people. it can take longer for people who have COVID-19 to show symptoms, which means that they're going around in the community coughing, sneezing, spreading virus for a longer time, or before they even show symptoms, they're spreading it. And they can be contagious for longer periods of time than people who are infected with influenza can be. And just a couple of statistics that I pulled up, just in regards to your question about healthy people. So they did some pretty big studies this year regarding younger people who died from COVID-19. And they showed that 173,300 people, 79.5% of excess deaths from March through August were COVID related. 4,535 deaths occurring from March through July in younger adults ages 25 to 44, or 38% of all excess deaths in that group. And I just share that because we've seen that COVID-19 has affected people of all ages, mostly people with underlying conditions, but also some people who have no underlying conditions. And we also know that it's having some pretty serious long-term side effects. We have people who still have symptoms after a year of having COVID-19. And something that's pretty unique to COVID-19 that is not found in the flu are people are getting really serious blood clots. There's some neurological illness that's related to COVID-19 as well. And we've just seen the mortality rate be much higher. I also pulled up some statistics from a study that was done at the VA. They found that the death rate among COVID-19 patients was 18.5%, while it was 5.3% for those with the flu. So people with COVID were nearly 5 times more likely to die than flu patients. They also found that COVID-19 patients were 4 times more likely to require breathing machines than people with flu, nearly 2.5 times more likely to be admitted to intensive care, and they stayed in the hospital an average of 3 days longer than flu patients. So we have been able to see through the research studies that came out this year that COVID-19 is significantly more deadly than flu. And even in healthy people or younger people, we have seen deaths, and you can pass the COVID-19 virus along to older people or more vulnerable people in your community who may not be as healthy as someone else. So getting the vaccine can help prevent that community spread and can protect other people. You know, whether if you got COVID, you would be totally okay, but what about, your family members or your neighbors? That's also part of the reason we have to consider vaccination. And Julianne, I don't know if you want to answer both of the questions that were in the chat. I don't know when you got cut out.
No problem. I'm sorry. I had some technical difficulties and I got bumped out of the meeting just after the question about ingredients in the vaccine. So if there's any other questions on that, I can try to answer, but I'm sure Nicole probably was able to answer those questions.
It looks like someone asked a follow-up, why is sugar and salt in these vaccines? Isn't that linked to more common diseases? So the reason I brought up those, so again, the salts are included to help balance the acidity of the mRNA in your body. And the sugar is helped to stabilize the molecules because they're kept at cold temperatures. So that's the reason why those are included in the vaccine. They're really just to help preserve the vaccine and protect it so that it can work effectively in your body.
Exactly. And these are just very, very small amounts. And so you don't have to worry about those things affecting your overall health. Don't worry if you have diabetes. The amount of sugar contained in a vaccine is very minuscule. So these are just, like Nicole said, things that stabilize the mRNA, which is the most important ingredient, and otherwise very, very small amounts.
Okay, we have another question. Are you aware that once a person receives the vaccine who has breast cancer experience lymph nodes in their breast? Why is that?
Do you want me to start off, Julianne? That's a great question, and that has come up fairly recently. So people who have had breast cancer and people who have not had breast cancer can experience lymph nodes that are swollen or tender in their armpit area around their breast. Lymph nodes are basically all over our body. As you may know, they help with our immune defense when we get sick. They are part of our whole immune system to fight off bacteria and viruses and illnesses. So when we get this vaccine, it kind of activates our immune system because it's learning how to fight off COVID-19. So once you get the vaccine, you have some of these side effects that we described earlier, the fatigue, the fever, soreness. These are all signs that our body is trying to build up this immune response. And lymph nodes can be part of that. So some people might find that they have some swollen or tender lymph nodes, especially in their armpit area near their breast. So one of the recommendations that did come out were that if you do have a mammogram scheduled around the time of your vaccination, you should plan to have it done before your vaccines, or you should wait at least 2 weeks after your second vaccine dose so that you can give your body and your immune system some time to kind of come back to center and for any swollen or painful lymph nodes to kind of go down. Also, because people who had these swollen lymph nodes that had a mammogram scheduled, they might have some confusing results on their mammogram that are not actually related to anything related to cancer, anything worrisome. It's related to your immune response from the vaccine. But it's not permanent. They should go away after, I believe it's 10 to 14 days after your immune system has some time to kind of adjust to the vaccine. Anything that you want to add, Julianne?
No, I think that's well said. Exactly. We don't know why some people might have, their immune system just might be active in that way, which again, you're just building protection against the, you're reacting to the vaccine in a normal way and building immune protection. But some people can experience this, and that is just the recommendation to wait to receive a mammogram if you can.
Okay, and we do have one last question. I only had a little soreness at the injection spot on my arm and no other side effects. I am 70 years old and had both doses. Is the vaccine really working in my body?
I can take that one. Wonderful to this person who was able to get vaccinated and got both doses. So yes, the vaccine is still effective in your body. Only a certain percentage of people experience side effects, so not everyone. And actually, younger people are more likely to experience side effects than older people. And again, these side effects are just signs that your immune system is working. But many people in the trials did not have any side effects, or just had, like this individual, a little soreness at their arm, like other vaccines that you've received in your life. And the vaccine was still effective when they studied it. So don't worry if you don't have more effects or more side effects. The vaccine is still working for you. And Nicole, if you'd like to add anything.
Nope, that's exactly what I would have said.
Okay. Well, on that note, I want to thank everyone for joining us. I want to thank our presenters, Dr. Julianne Burns and Nicole Spector. And we appreciate this was a fantastic program. And we wish everyone a wonderful evening, and to be well and to be safe.
Thank you.
Thank you very much for having us.
Take care.